Crisis Intervention Communication by Jones HMMBADMS. The goals of crisis intervention communication are to establish rapport, identify the most important concern at that moment, assess the person's perception of the problem, facilitate the person's expression of emotion, recognize the person's needs, implement interventions designed to address the needs, guide the person toward identifying a plan of action to an acceptable resolution. Beliza, 2020. In order to be effective in the process of intervention with an individual in crisis, it is essential that the clinician use effective communication techniques. The most essential of these are active listening skills. Active listening involves listening with all the senses. This means seeing the person in front of you, hearing the person's voice as they speak, observing how the person's speaking and presence makes you feel, noticing any smells and sometimes even what you taste. It is the ability to completely focus on a speaker, understand the speaker's message, comprehend the meaning of the information, and respond effectively. The practice of active listening is complex, as each skill involved is used concurrently with the others while also trying to remain empathetic and objective. Active listening is, essentially, a form of feedback. Attending acknowledging. It is important to provide verbal and nonverbal awareness of the speaker and to convey an interest in what the speaker is saying. This provides an invitation to continue to talk. Examples: aha, when, I see. Nonverbally, the listener can convey interest by facing the speaker, maintaining eye contact, nodding, and smiling. Small smiles combined with nods can be powerful in affirming that messages are being heard and understood. Because eye contact can be intimidating and culturally specific, it is essential to gauge how much is appropriate. It is often best to use eye contact along with smiles and other nonverbal messages. The listener's posture can indicate attentive listening. These may include leaning slightly forward or sideways while sitting, slanting the head slightly, or resting the head on one hand. Another nonverbal technique is referred to as mirroring. This may involve the automatic reflection of the facial expressions of the speaker and can indicate empathy. The slight mirroring of posture or gestures also can build rapport. Mirroring may also include speech pacing, vocabulary choices, volume and tone of voice, as well as speech patterns. Mirroring, however, must be genuine to be effective. Kernoyer, 2017. Beliza, 2020. Clarifying. Clarifying involves seeking information to make clear that which is not meaningful or that which is vague, in order to avoid making assumptions that understanding has occurred when it is not. It is the ability to reflect back to the speaker the words and feelings expressed in order to ensure that they have been understood correctly and that both the speaker and listener agree upon a true representation of what has been said. Examples: listener, I am not quite sure I understand. Can you tell me? Listener, do you mean that? Listener, are you telling me? Listener, are you saying? Listener, have I heard you correctly? Clarifying uses restating and paraphrasing to show an understanding of what the speaker has said and to help the speaker evaluate feelings by hearing them expressed by someone else. Restating is repeating the main idea expressed in approximately or nearly the same words the patient has used, while paraphrasing involves the use of other words to reflect back to the speaker what has been said. When paraphrasing, it is essential that the listener does not ask questions, is non-directive, and is non-judgmental. It shows the speaker that the listener is attempting to understand what has been said. Examples: speaker, I don't sleep. I stay awake all night. Listener, restated response, you don't sleep, you stay awake all night. Or listener, paraphrased response, you have difficulty sleeping. When restating and paraphrasing, it is important to observe for nonverbal and verbal cues that confirm or refute the accuracy. Kernoyer, 2017. Vidbeck, 2020. Emotional labeling. During a mental health crisis, feelings may often be confusing and hard to define. Some people experience greater difficulty labeling their emotions than others do. This inability has been found to be associated with deficits in the ability to regulate those emotions. The less aware a person is of their emotions, the less likely they may be able to regulate them. Emotional labeling allows a clinician to apply a tentative label to the feelings the person is expressing or implying by words and actions. Labeling emotions lets the person know they are being heard and helps the person make sense of them and gain some control. The simple act of thinking about and then labeling an emotion can distract from and disrupt the intensity. It is important not to assume one knows how another person feels. It is helpful to ask if a label is correct. Examples: Listener, you sound very frustrated. Is that right? Listener, am I correct in saying that you feel overwhelmed by everything? Speaker, I'm stuck out in the middle of the ocean. Listener, you're feeling alone or deserted. Is that true? It is important that the speaker's emotions are validated and not minimized. Labeling and acknowledging emotions help to restore equilibrium. Kernoyer, 2017. Weidbeck, 2020. Probing skills. Probing skills involve questioning, and the most useful forms of questions are open-ended. These types of questions encourage exploration and begin with probing words such as when, what, where, how, or who. They elicit more and fuller information than closed-ended questions by requiring more than a simple yes or no answer. The use of open-ended questions encourages the individual to continue to talk. It is also important to avoid why questions, as they may be interpreted as accusations, resulting in the person feeling defensive. Why questions may also imply that the person should know something that they may not know. Examples: Listener, what were you thinking, feeling? Listener, how did you act? Listener, when did that happen? Listener, where did you go afterward? Listener, whom did you go with? Kernoyer, 2017. Effective pauses. Silence. Part of effective communication includes the use of silence and waiting or pausing before speaking. Silence and pauses can be used effectively for several purposes. Silence allows the person to take control of the discussion. Most people are not comfortable with silence and will talk in order to fill it. Therefore, a period of silence may encourage a person to continue speaking. Silence can also be used to emphasize a point just before or just after saying something important. Kernoyer, 2017. iMessages. iMessages can be used to convey feelings, concerns, needs, and expectations without making the other person feel attacked. U-messages tend to put people in defensive positions, whereas an effective iMessage places the responsibility and focus on the communicator instead of the recipient. iMessages allow people to know in a non-threatening way how the other person feels, why they feel that way, and what the patient can do to remedy the situation. Clinicians use this technique to refocus the patient or when the clinician is being verbally attacked. Examples: Listener, I feel uncomfortable when I'm spoken to that way. Please don't yell at me. Listener, I need to better understand what I heard you say. Tell more about that. Fogging is a related empathic technique used to slow down a potentially explosive situation. It is a way to accept critical remarks by using iMessages. When a patient is being critical, the listener accepts the criticism or part of the criticism, even if it is untrue, and repeats it back to the speaker. Example: Speaker, you're so stupid. Listener, yes, I can see that you don't think I'm that smart. The word yes takes the person by surprise, slows them down, and reduces tension. The listener is not agreeing that they are stupid, rather they are acknowledging that the speaker thinks so. Kernoyer, 2017. Townsend, 2018.